to the HDC Chat Series.
Healthcare in general, globally, has to become more patient-centric.
Artificial intelligence is the driving force behind healthcare innovation. He is dedicated to develop.
If the clinician doesn't understand how the AI works, they're never going to trust it.
Your career spans clinical practice, innovation, and academia. How have these diverse experiences influenced your leadership approach in driving healthcare innovation, particularly through AI?
AI will never replace the operator or the clinician.
Welcome to the HDC Chat Series, where we host special guests and speakers from around the world to share their experiences and groundbreaking insights at the convergence of healthcare and digital innovation. My name is Dr. Rashida Parks, and I'm deeply honored to have Dr. Barry Stein as the inaugural speaker of the HDC Chat Speaking Series with a focus on AI innovation in healthcare. And it is a privilege to feature his insights as we launch this initiative. Dr. Stein, thank you for joining us today.
Hi, it's wonderful to be here, Dr. Parks.
Wonderful. Dr. Barry, let me briefly introduce you, and then we'll go ahead and start with our questions. Dr. Barry Stein is an experienced physician executive and innovation leader with expertise spanning multiple medical domains, specialties, and organizational functions. As the Chief Clinical Innovation Officer and Chief Medical Informatics Officer at Hartford Healthcare, Dr. Stein spearheads initiatives at the Center for AI Innovation in Healthcare, recognizing artificial intelligence as the driving force behind healthcare innovation. He is dedicated to developing enterprise capabilities that harness AI transformative potential in a safe and trustworthy manner. There's so much more to Dr. Stein's experiences and groundbreaking initiatives, and we will start with our first question to peek into his work and insights through today's interview. Students and professionals alike are at the intersection of healthcare and digital innovation, are eager to learn from you today, Dr. Stein.
Yeah.
All right, I will start with our first question. Your career spans clinical practice, innovation, and academia. How have these diverse experiences influenced your leadership approach in driving healthcare innovation, particularly through AI and analytics?
Thank you for that kind introduction, Dr. Parks, and it's a great question. Yeah, I've had the privilege of traversing many of the different domains, and what I've come to realize when we talk about innovation, and innovation is something that people talk about often, but in my mind and in many different places, innovation is a simple equation, which is finding a problem to solve that really matters, and then looking for the solution or the idea to solve that problem. So it's taking an idea to solve a really meaningful problem and then executing upon that idea. So simply put, innovation is equal to idea times execution. If you've just got an idea and you haven't executed it or implemented it or it's being used, it's just an idea. But if you take a great solution to solve an important problem, and you can implement it and execute upon that for clinical impact or operational impact, that's innovation.
That's a really great formula. And you live by it, as I've seen so many of your great achievements, even when I visited you at the Hartford Healthcare Hospital. Thank you for this wonderful insight. I'm going to move to the core of our questions. AI is often viewed as both a disruptor and an enabler in healthcare. Could you highlight specific areas where Hartford Healthcare and you specifically has successfully applied AI? And if you can share some examples, and especially the impact on clinical and or operational efficiency using the formula that you just introduced to us.
Yeah, and thanks a lot. I just want to embellish a little bit on that formula, because it will inform at least the way I answer the questions that you gave to me in terms of that's the formula. Innovation is equal to idea times execution. So the real sort of essence around having traversed the clinical domain, the leadership domain, the academia, the operational domain, it really provided me the sensitivity or the recognition that for innovation to occur, it's vital to have many different lenses, expertise at the table, leaning in to both develop the ideas, to make sure that they understand the problem correctly, and then having the right people at the table to execute. And ordinarily, it's never one or two people that can do all. It really requires a multi-stakeholder approach and effort to take an idea that solves a problem and execute it in a safe way and in a sustainable way. So with that being said, your question related to how have we at Hartford Healthcare deployed AI in a meaningful way, both clinically and operationally. I can give you two or three examples, and I'll begin by sort of sharing with you an experience that we had working with an academic enterprise, MIT, much like Quinnipiac, with the students and the professors, working on a problem that was very meaningful and very potentially impactful. And that was around the COVID time. We had had the good fortune of having done a fair amount of muscle building and understanding of AI in a bidirectional way prior to COVID with some professors and students, so that there was an organizational readiness to understand what AI is and what it is not, and what the potential impact could be. And then COVID hit. And it's very difficult to remember those times where we heard on the news, COVID, and everything just shut down. And in
Yeah.
healthcare, that was a very significant challenge. And what we had done with our partnership at that time was we developed predictive COVID models. And by that I mean, we developed models that predicted how many patients were going to come into our emergency room every day in every region of
How
our health.
important was that for your organization to be able to predict that number of patient that will be coming to your emergency or to the hospital?
It was vitally important. And I'll share with you why and how. So we were able to develop that predictive model very accurately. We were also able to predict how many patients who were going to need ICU beds and ventilators. And if you remember correctly, way back when COVID hit, we didn't have PPE, we didn't have enough ventilators in the country. So it was about using those analytics, those prediction models, to develop operational plans on a daily basis of how many patients would come in where, so you could deploy your scarce resources in an optimal way. And we literally use those algorithms on a daily basis that were clinically relevant, of course, because now we were prepared for what was coming our way clinically and operationally, whether it was for PPE or for ventilators or for staffing optimization, we had a much better idea of how we were going to be successful in taking care of those patients. It was, to me, that quintessential moment of where AI really could make an impact, both clinically and operationally. So from a clinical standpoint, patient had better outcomes. And from an operational standpoint, from the hospital, we were far better equipped in understanding what we were going to need and in an anticipatory kind of way, plan for it rather than firefight, meaning react to a problem on hand when we could easily have predicted. So that was a wonderful example of both clinical and operational. We've got other
Interrupt you for, oh,
share.
sorry, interrupt you for a second. You, as a faculty, as a researcher in AI and analytics, you mentioned something really important, which is the interdisciplinarity of efforts in deploying AI. When I teach my students machine learning and being able to predict some outcomes, sometimes the focus is on the model, to have the best model there is that's going to give you the best prediction. You introduced, and in your example, you spoke so much about the context and that convergence between the AI tools and the field of medicine, which is extremely relevant not only to students that we teach, but also to professionals. You cannot just understand medicine alone or be a data scientist alone, and you converge those two into better and impactful outcomes. So thank you for that examples to bring it together again for professionals and students. And I would welcome more examples in this area, whether clinical impact or operational impact.
Dr. Parks, that is such a critical concept that I could not stress enough. AI and machine learning is such a sophisticated discipline that has evolved rapidly. And there's a whole body of knowledge and understanding and language that healthcare is not accustomed to, not comfortable with, not at all equipped to sort of talk about and navigate comfortably through. It's a separate language that's evolved with unbelievable velocity. There's very little education in healthcare at the medical student level, at the postgraduate level, as well as when, in the attending level of AI, the actual understanding of AI. We all learned about the pathogenesis of disease. We all understood how different drugs worked, the mechanics of how drugs work, how devices work, how diseases are understood. We learned the language, we learned the frameworks so that we could apply them safely in delivering care. The pharmacokinetics. You can't just describe a medication without understanding how it works, what the side effects are, what the optimal indication is, what happens if you see a side effect, what does it interact with that you're giving in addition to that drug. That's how we are trained as clinicians. So now you bring in AI, you don't understand the language, you don't understand how it works, you don't understand the mechanics, you don't understand the risks. It is tremendously difficult to use something in healthcare that you don't understand. On the flip side, you've got students that are incredibly smart and bright and sophisticated in this realm that are developing models, and models in isolation from the clinical or operational context can be extraordinarily incorrect. The model can be correct, but the application in the real world can be way off.
I
And the
agree.
combination of the data scientists talking to the operational and clinical team and learning from one another. Oh, this model doesn't make any sense. Help me understand it. Oh, the data scientist is saying, oh, I get it. I've got to do this, this, and this, because now I understand why it'll never make sense and it's not correct. And it's an iterative process. And the power of that iterative process cannot be overstated. So going forward, it is vital where academics and developers and healthcare enterprises figure out a way where they can work together efficiently to unlock that potential safely.
This is something I'm thinking of the fly right now, but I encounter many times. When you talk to subject matter experts, and in this case, clinicians, there's that fear of the AI and data analytics providing models that are conflicting with their training and their decisions. And that fear is making them push away this transformative technology that can augment their capabilities, whether in radiology, whether in surgery. What is, as a clinician that embraced and led and spearheaded so many AI initiatives, what is the word of wisdom you can share with subject matter expert, not the data scientists, how they can approach this, I won't call it technology, but this innovation in practicing medicine?
Yeah, it's another wonderful question and such a key one as we do the change management around AI and all its potential in healthcare. I think it goes back to making sure that the clinician has a deep understanding of how the model works. So when we call it non-black box AI, it's for a reason. There's going to be, I would say, very slow adoption, if at all, of AI that's black box, no matter how good the model is. If the clinician doesn't understand how the AI works, they're never going to trust it. And when you're dealing with a patient's life, the responsibility is ultimately on the clinician to understand everything they're doing and everything that they are not doing when optimizing the care of their respective patients. So the first of which is whatever model bringing in, making sure that the problem you're trying to solve is a significant problem for the clinician. And talking about that first. The second of which is to start sharing the possibility of this model complementing the armamentarium that they're already using today and the reasons why it's complementary. Not conflicting, but complementary. The third piece is meet the clinician where they are, meaning some are going to be more sophisticated than others in this realm of understanding of AI. Their journey, they may be just starting their journey, they may be well along the way in their journey. But being aware that this is a journey for a lot of clinicians, for most, and understanding where they are so that the data scientists can, number one, understand the problem, number two, have the opportunity to help the clinician understand how these models work, why there's so many variables, what's area under the curve, why is that important, how do I see why this model predicts this? What are the significant variables that are driving that prediction? Help me understand these predictive models that aren't necessarily easily understandable initially. Help them understand that. Decrease the fear of the unknown. And how do we do that as educators? Educate, educate, educate. Knowledge is very, very powerful here. And I believe that the data scientists are in a fantastic position to equip themselves with the ability to tell the story in a non-threatening way
That's
for
so
their clinical
insightful.
colleagues.
Thank you. Thank you so much. At Quinnipiac University in my AI research, I try to embrace um, this multi-perspective. I started solo at the beginning and quickly realized there is no way I can develop a model that has a value that could be embraced. So medical doctor from the medical school joined the effort, and medical students. And then again, we realized some shortcomings. There is the ethical part, there is the legal part. Then a JD joined us into this research with impactful with or applicable solutions to the world. And it was so much richer experience for all of us to see all those aspects that you're talking about. It's definitely a mindset. It's an AI journey with a mindset where you're looking at the possibilities rather than a solo focus on one area. And since we're talking about this value and this mindset in that space, how do you ensure a balance between, especially at the leadership level, at the innovative level, leading the AI center? How do you ensure that balance between advancing innovation in medicine, whether clinical or operational level, and maintaining safety, trust, and ethical consideration of AI adoptions that you started already talking about a couple seconds ago?
I can't agree with you more. It's such a rewarding, enriching experience talking about AI through in the company of all the different lenses. And you mentioned many of them. And the way we've approached it at Hartford Healthcare is the following way. And there are multiple different ways. But we stood up or we launched our Center for AI Innovation in Healthcare with the singular goal of unlocking the full potential of AI for our patients in a safe and trustworthy way. So it's really striking that balance as you spoke about, putting your foot on the accelerator so that you can really deliver the full potential, but also having incredibly strong brakes. It's like going around a racetrack. You can only go as fast as you confident your brakes will work when you need them. If you don't have brakes, you ain't going a few hundred miles an hour. So how do you strike that balance? And we've gone through multiple iterations in the organization, but we really do believe that it's important over the next 5 years, 3 to 5 years, for everybody in the organization to feel a sense of responsibility about exciting and looking for all the potential, but at the same time understanding the risks. So in healthcare, it's very, very important for everybody who's participating in the delivery of care to have enough knowledge to be able to pull the cord, so to speak, to stop the line when there's risk. So how do we do this? It's three-layered in our organization. The first of which is the request to deploy AI always comes from the business unit or the clinical unit. Why? Because it's never about, oh, I found a great technology, let's look for a problem. It's the business unit or the clinical unit coming to us with a problem that they want to solve that they think AI can help them solve. And what we do there is give them the responsibility to highlight the problem that they're trying to solve so everybody understands that, as well as the opportunity to surface a few solutions that they're interested in. And thirdly, we give them a brief survey, a risk survey for AI. Is the bias? Where's the data coming from? How are you going to monitor this? How are you going to report on this? How are you going to educate your colleagues? This then provides the onus or puts the onus on the clinical business unit to own that process, as well as to be sensitive to some of the things that may not necessarily have been in their language or on their radar before. Bias, well, what do you mean by that? Data sources, well, monitoring. So that's the first layer. The second layer is there's an evolving regulatory constraints. By that I mean, whether it's the FDA, whether it's the Office of Civil Rights, whether it's Joint Commission, there are many different regulatory constraints that are evolving to protect our patients. And for that, you need sophisticated input. So we've got our compliance team, we've got our legal team, we've got our privacy team, we've got our ITS security team, we've got our ethics team, leadership, I should say, and research leadership involved in that layer to pressure test the potential AI solution against the regulatory constraints. That's the second layer. The third layer is for the executive level of this organization to be aware of what's being deployed so that there's an awareness from the bottom up and top down of what's transpiring related to AI, who's responsible for what, and holding all three accountable for their respective functions. So if you take one step back, we've now got this multi-layered approach around a rapidly evolving area where we want to unlock all the potential, but we want to have all the safeguards. And it's not owned by one person or two people or three people or a committee. It's a responsibility that is on a lot of folks. And the more the people understand the potential as well as risks, the better off our patients are going to be, and the quicker we're going to unlock all this potential. So that's in broad strokes how we manage this. In our center, one of the pillars is governance, which is key.
So thank you again for talking so much about the term that we use sometimes is AI strategy that involves the leadership, that involves the managerial, and all the way to the regular person that is either typing or providing some clinical care. Those three layers are very important. However, not every single organization is embracing it, whether in the US or globally, having an AI strategy where you go by from that ideation, all the way to delivery and measuring the impact. So, talking about measuring the impact, that's a hard question to many leaders when I talk to them, is how do we measure it in terms of impact on patient care, impact on operations, impact on no-shows, or how fast we handle the booking or scheduling. How do you, within Hartford Healthcare and the AI Center for Innovation, measure the value and the impact of all these valuable initiatives that you undertook?
Um, Let me share with you philosophically or in principle how we do this and give you an example of a few. In principle, when a business unit or a clinical unit presents the problem that they want to solve, we ask them to fill out an S-bar, like, a situation, background assessment, and recommendation to advocate for their request. Within that, there is a requisite to put the metrics by which they are going to measure themselves and the solution against to determine if they're successful or not. And de facto, that becomes one of the justifications for the problem they're trying to solve. Meaning, and I'll give you an example, length of stay. We developed algorithms with a company that we spun out, H2O, that predicts length of stay. We could pick multiple different metrics to determine if we're successful. But the problem we're trying to solve is one that not only we are challenged to solve, but every hospital system in the country and probably in the world. A patient comes into the hospital. We try and predict with heuristics by experience that this patient is going to be in the hospital for 3 days. They've got pneumonia. Ordinarily, on average, they'll be in the hospital for 2 or 3 days. But that's not taking into account numerous other variables that we could, but the human brain can't factor all that in. The fact of the matter is, in most hospitals, length of stay is far longer than it should be. And because of that, anytime you're in the hospital for longer than you should be, you are prone to more infections and more issues occurring. So it's not always the safest thing to be in a hospital for longer than you should be. Number two, you're now occupying a bed that you shouldn't be occupying, that somebody else absolutely needs, and we have capacity needs. So I'm just giving you two sort of metrics. And the third one is that most of the time hospital systems are paid by diagnosis. So if you've got pneumonia, an insurance company will pay you for 2 days. And what happens if now the patient's there for 5 days? And if you could have predicted some of these things, you could have taken care of them earlier and out of the hospital. So there are very distinct metrics that you can then a priori apply and say, these are the things that we're hoping to achieve and improve upon. And it's incumbent upon us as organizations and business units to monitor them and report out. So when it comes to general metrics, each use case should have metrics that amplify the problem you're trying to solve and demonstrate that you've solved it with the solution.
There is definitely a good reason why you're the inaugural speaker for this HDC Chat Series. You're providing us with so much wealth, and I still have a few more questions if your time allows. I recently attended a conference in Dubai, which is the GCC eHealth conference, where leaders in AI and healthcare executives in the GCC region got together along with experts from around the world to talk about the potential of AI to redefine healthcare delivery in that region. As an international innovator in the convergence space of AI in healthcare, what are some of the insights that you could share, not only nationally but globally, that could be transferred within different contexts?
Um, there's so much to talk about on that topic, but in a nutshell, I think as a clinician, I always think about healthcare in general, globally, has to become more patient-centric. Up until now, as much as we've tried, it's still healthcare system-centric, clinician-centric, but not patient-centric. And by that I mean, in all other parts of our lives as consumers, there's a much better notion of the consumer centricity, whether you want toothpaste overnight, whether you want a book, whether you want furniture delivered, whether you want an Uber, there's a centricity around the consumer. And in healthcare, that's been devoid for many, many reasons. And we've tried for many, many, many years and decades to make it more centric. And we haven't succeeded the way the consumer, the patient, demands it in every other part of their life. And let me give you 4 areas that, at least at Hartford Healthcare, we focus on, and we believe the world is focusing on moving forward, and where AI can make a massive difference. 4, A squared, E squared. It's the second formula. We've got to be able to improve access to healthcare for our patients. And we've tried in a myriad of ways and not succeeded anyway well for our patient. It doesn't matter how good your healthcare is in your system, or if patients can't get access to it easily, it's just an idea, it's not executed. The second one is healthcare has to become more affordable. The third one, that's the A squared part of the deal. And we can talk a little bit about how AI can drive that more powerfully and more transformatively than any other technology that we've ever had before. The
Totally
E
agree.
squared part of this is it is an imperative to bend the curve on equity. Right now, there's an asymmetric distribution of healthcare delivery, depending on your zip code, your income. It is not okay. The status quo is not okay. And I could not think of a more meaningful application for AI to make a difference for those that haven't enjoyed the benefit that relatively few have. And then fourthly, drive excellence, quality and safety to another level, where the care we deliver is personalized, is precise, delivered at the right time for the right patient with the right treatment every time. So those are the 4 areas, and they're large, that any application of AI can make a huge impact, not a step function impact, an exponential impact in healthcare.
I am trying to breathe through all your comments. And I'm going to share a quick experience. I had the privilege and honor of being a Fulbright awardee, where I went to Morocco for 6 months. What an experience to be able to explore, one of the terms that you use, to explore, have that inquisitive mind to how we can leverage AI in healthcare in another country, in a developing, growth-oriented country, and learn so much from their initiatives that are very driven towards giving access to those who normally wouldn't leveraging AI through remote areas or diagnosing diseases that are prominent in those areas. So I absolutely agree with those 4 points that you shared with us. Absolutely critical to our entire audience listening to this today. Um, I'm going to conclude with one last question. As Quinnipiac University faculty, we focus on interdisciplinary education because that's what's going to help our students when they go out in the marketplace. Our students are, I'm teaching a course in AI and analytics in healthcare, and I have MBA students, I have business analytics graduate students, AI students, and medical students from the medical school. In addition to professionals that are either medical doctors or others, what advice, what academic advice, and clinical and leadership advice combined together would you offer to help them become more active and impactful contributors to the AI-driven transformation in healthcare? So how we send them away with insights to keep the ball rolling.
Um, my thoughts around that, I think, follow thematically what we've spoken about, the interdisciplinary approach and the necessity to actually equip yourself while you're going through any one of those training journeys that you've described. Understanding when it comes to AI, it is a language, it's a tool that's a differentiator. And it's a very different language and it's a very different tool than we've ever sort of experienced before. And it requires a multidisciplinary sensitivity and understanding. So, how do you take what I've just said and leave your academic enterprise with that, I would say, knowledge or confidence that will differentiate you in the marketplace, whether you go into academia, whether you go into corporate, whether you want to do your own startup? While you are in your academic environments, to seek out those faculty that understand the interdisciplinary power, to seek out the faculty that have the partnerships with industry, with startups, and with healthcare systems, that have research ongoing, that you can be immersed in the conversation of healthcare and AI delivery. Immersively. I use the word immerse. It's not a one-off, it's not a two-off, it's not a three-off. It takes a while to build the muscle. And the more you in the conversations and the more you're part of the contribution of the ultimate solution for the problem, the better everybody becomes. And what I've seen in our experience, it's just our experience, is that it starts off in a slow way, and exponentially people see the power of that working together. So no longer do you have meetings in isolation. In other words, the meeting is not complete unless you have everybody there. The researcher, the scientists, the legal folks, the clinicians. It becomes a team. And that team builds the muscle. And each person in that team leaves far better equipped wherever they're going to go, whatever avenue they are pursuing, in a differentiated manner, especially the students who leave that can say, I was involved in this research with these folks around the table, and I've got a much better understanding of how healthcare works, the opportunities, the risks. I understand the ITS security issues. I understand the legal issues. I understand the compliance issues, not abstractly. But I was involved in this project or this initiative with these folks to solve this problem.
It is amazing how you convert, or you use both your clinical background and your leadership abilities and initiatives to share a message, an insightful and thought-provoking message when you start talking about muscle development, understanding this convergence of AI in healthcare is a muscle that we and students and professionals need to keep working on to get the best out of it. So we're coming to the end of this wonderful interview. Any final words or key takeaways before we conclude?
Thank you, Dr. Parks, for a wonderful conversation and opportunity to share our experiences and excitement around AI. The thing that I would want to share with students and academia is the following. When we talk about unlocking that full potential of AI for our patients in a safe and trustworthy way, you have the opportunity to catalyze the very beginning, what I would call bench research. And the trick and the opportunity is for those in academia to recognize partnerships with healthcare systems and be a driver in the journey from bench, the research, to bedside. And to be a contributor the whole way through. Because I can share that the researcher is that vital all the way to the bedside. Because it's a language and a skill set and a complementary partner that you bring to the table. And just the last thing, and I always end by this as often as I can. AI will never replace the operator or the clinician.
Absolutely agree.
But the clinicians that don't equip themselves with the dexterity and comfort of AI will be replaced by those clinicians and operators that do.
You always see both sides of the equation. That's why you have an open invitation to come in anytime. Dr. Stein, you provided us today with rich and thought-provoking discussion. On behalf of everybody watching and listening, we appreciate your time and your invaluable expertise and insight in today's interview. Thank you again.
Thank you very much, Dr. Parks, and it's a wonderful pleasure to be associated with Quinnipiac.
Take care.
Bye-bye.